Good morning. Thank you for attending this educational webinar on this nice summer day. Today we'll go over the Centers for Medicare and Medicaid Services Legionella bacteria policy, which became effective in June. The audience is in listen-only mode, which means you're muted during this presentation. However, I encourage you to type questions in the box at any time during the presentation. I will answer them if time permits at the end of the presentation. Any that I don't get to, I will follow up with you directly, I promise. First, I'd like to introduce myself. My name is Nora Rothschild. I've been with Barclay Water Management for 15 years, specializing in microbiology and water systems. Our agenda today is to clarify the Centers for Medicare and Medicaid Services regulations, to cover what makes a complete water management program, and to talk about Legionella bacteria in water systems. Again, type your questions in the box at any time. On June 2nd, 2017, the Centers for Medicare and Medicaid Services took a strong step towards reducing Legionella risk in healthcare facility water systems. This Legionella requirement is the latest to emerge following recent new requirements in New York State. CMS sent a memo to their state survey agency directors that, effective immediately, the surveyors were to survey all CMS certified healthcare facilities to make sure they have policies and procedures in place to reduce the risk of growth and spread of Legionella bacteria and other opportunistic pathogens in building water systems. Hospitals, nursing homes, and critical access hospitals are expected to comply with these requirements to protect the health and safety of their patients. Starting now, during their surveys, CMS surveyors will check that each facility has a water management program in place. A water management program by design should include a facility risk assessment, also called a hazard analysis, to identify locations in the water system where Legionella bacteria and other opportunistic waterborne pathogens can grow and spread. This water management program will also include specific control measures and monitoring strategies for your unique facility. It will include corrective actions when control limits are not met and a validation process to be certain that the program is effective in meeting its goals. CMS points in this memo to two sources which outline how to create a water management program. The sources are ASHRAE, American Society of Heating, Refrigerating, and Air Conditioning Engineers, and the CDC, Centers for Disease Control and Prevention. These documents were published in 2015 and 2016. CMS surveyors will look for this type of document to verify that the healthcare water systems are being maintained in a way that minimizes the risk of disease. Following directly in the footsteps of ASHRAE, in 2016, the CDC released a guide titled Developing a Water Management Program to Reduce Legionella Growth and Spread in Buildings. This document is a toolkit which was created to guide how to put together a water management program in accordance with ASHRAE Standard 188. Although this guide is informative, people may find that it's best to outsource creating a water management program to hygiene specialists. It does take quite a bit of work to put these water management programs together. The toolkit helps explain water management programs in general, but does not take into consideration complexities within your own specific system. Developing and maintaining a water management program is a multi-step continuous process. The program is created, followed, and updated over time based on changes in your water system or your validation results along the way. The program must be reviewed at least once per year according to CDC. For ongoing verification purposes, we find it's best to meet as a team on a quarterly basis. Meeting and reviewing once per year does not quite give this document the attention it deserves as an ongoing safety program. According to ASHRAE and CDC, there are a number of risk factors which can contribute to a building needing a water management program. Any one of these factors puts your building at risk for possible spread of disease. These factors include having a building 10 or more stories high. This leads to complex piping, which can create amplification sites for Legionella bacteria, which come in with the city water. Multiple rooms served by a centralized water heater. This has to do with possible dead legs and long amplification sites. If you're a healthcare facility where a patient's stays exceed 24 hours, this has to do with patient exposure factors. If you're there for 24 hours, chances are you'll be using ice from an ice machine. You'll be closer to air intakes for longer periods of time. You'll be showering with the water and using the faucets. If you have immunocompromised individuals, certain population types are susceptible to the risks of waterborne pathogens more than others. If you have a cooling tower, an ornamental fountain, or a whirlpool spa, these are locations which Legionella are known to amplify and spread. And again, if you're housing occupants over the age of 65 years, unfortunately, this again is part of a more susceptible population, although healthy people still can contract the disease. To have a complete water management program, these are the steps that you'll want to take. First, you'll want to form a program team. This is really important. These people will be meeting to verify that the program is working, and they'll really be communicating together. So who will be on your team? You'll want at least one person with knowledge of the water systems. This person may be a plumber, an HVAC, or facilities, or all of the above. You'll want a safety officer and an infection control person on the team. These people will be confirming the program performance and looking at overall safety. You want people to monitor and document that things are happening. You want a director or a vice president to oversee the program, someone that can make decisions and reach out to the whole team. And lastly, you want someone with knowledge of waterborne pathogen control strategies and regulations. A water hygiene professional would be great to have on the team. Once you have your team in place, you'll begin doing a hazard analysis of the entire water system. You're going to look at where the water comes in, how it's processed, and where it goes. And along the way, you'll be identifying hazardous conditions. These are called your control locations, or points in which the bacteria growth and transmission can be minimized. These locations will be your entry point, your water heating areas, where it goes, the cooling towers, the outlets, the spas, the decorative fountains. For each of these control locations, you'll establish control limits. These will be what you want to make sure to measure and keep within range. And you'll create and implement a system to monitor the control of the control locations. Documenting is very important here. And you'll have corrective actions to be taken when monitoring indicates that control limits are not quite met. Along the way, you'll be having verification meetings and you'll be doing validation. CDC says sampling for Legionella is a great way to validate that your plan is working in the way that you'd like it to work. Here's one example of a control location. This example is a cooling tower. Some of the control measures you'll be taking for this control location are cleaning and disinfecting the cooling tower at a specific frequency. OSHA recommends 2 times a year. So you'll have a plan in place for that. You'll make sure to follow an SOP, and you'll have a record of this happening. You'll make sure that you have a plan in place so that any system that has been stagnant for 5 days should be cleaned and disinfected before put into reuse. You'll have that as your protocol. You will take that action when necessary, and you'll document that that happened. You'll use proper water treatment chemicals. You'll document what you're using, how you're feeding, and measure residuals on an ongoing basis. You'll feed your oxidizing biocide daily. You'll have a program for your side stream filtration, test for total bacteria, visually inspect the tower and chemical feed station, record that this is happening. Documentation is very important here. And test for Legionella bacteria quarterly and take action if levels are above 10 CFU per mil, for example. Other control locations may be your hot water storage tank. And an example of a control measure there will be keeping your hot water storage tank at 140 degrees Fahrenheit and measuring that daily and logging that. According to the CDC, Legionnaires' disease is on the rise. In the United States, reported cases of Legionnaires' disease have increased by nearly 4.5 times since 2000. Most illnesses occur in the summer and early fall, but they can happen anytime. Because of this, the CDC is putting extra importance on putting responsibilities on facilities to take care of their water systems. The CDC did a study. They found out in all outbreaks, one or more of the following has occurred. The first one is a lack of familiarity with building water systems. Well, this is no surprise. These building water systems can be quite complex. So by creating a water management program, which includes flow diagrams, that'll help you understand your building water systems and where you're going to need to take controls. And if you are taking controls, how you can tighten them up and really document them. In addition, you'll find out maybe there's a section in your building water system that isn't quite properly maintained. You may be on the way to properly maintaining it, but you can really tighten up your protocols there. The second situation that had occurred is a lack of effective microbiological control. Maybe your disinfectant was too low, and this may not be your fault. Maybe watering entering with the domestic water had a disinfectant level that was too low, and by the time it reaches the end of your system, it's non-existent. Maybe your domestic hot water piping or cold water piping is not insulated properly, meaning temperatures don't stay cold when they're supposed to stay cold, or don't stay hot when they're supposed to stay hot. There may be not much you can do about that, so you may have to make some changes in other areas or test more to see how that's going. And the third is a lack of coordinated prevention efforts. Well, this is no surprise either. People are really busy doing what they're doing. You may have facilities that is running around like crazy. You have infection control running around like crazy and really no time to meet. So once you have this program in place, you'll set up some time, quarterly basis, to really touch base, see how everything's going, and have more of a connection there. Not enough teamwork or education about the water system. Again, by doing a water management program, you'll have flow diagrams, you'll know where your hazards are, you'll have photographs and pictures and examples, and there won't be any guesswork going on. Some Legionella bacteria sources include cooling towers, shower heads, hoses, faucets, water fountains, whirlpool baths and spas, decorative water fountains, ice machines, and dental lines. All of these water sources have been linked to Legionnaires' disease cases. All of these systems should be part of your hazard analysis and control locations, and each one will have its own maintenance schedule and validation check. Let's talk a little bit about some of the causes of Legionella amplification. It's well known that Legionella bacteria are has a direct risk in conjunction with temperatures. So having your hot water storage at 120 degrees puts you in a much higher risk than having your hot water storage at 140 degrees. You may not have any control over this, but at least you can know it and really know where you might need to do some cleaning or extra testing. Your hot water outlet taps, your spas and showers and cooling towers are among the highest risk, where your cold water mains are at a low risk. However, in the summer months, this may heat up and become higher. Cold water services are a little bit higher risk, but not quite in the location of hot water storage. So temperature has a very, very big impact on the multiplication of Legionella bacteria. Below 68 degrees, Legionella bacteria are still alive, even in ice, but they're not multiplying. Once you get to the mid-60s and up, Legionella bacteria are multiplying rapidly. By the time they get to 90 degrees, where most people's hot water outlets are, they're multiplying rapidly. That's why those should be some of your most important control locations. What are some of the characteristics of a building water system which cause amplification of Legionella? Having a complex network of piping. This leads to dead legs and stagnification. Small diameter piping, so there's more area of the piping is covered with a biofilm. Tepid water temperatures are right in that area where Legionella amplify. Again, stagnant and excessive water age. There are truly areas in every single building where water systems aren't used. They may be rooms that are used for storage. They may be rooms that are not used all the time. You may have construction going on, and so you may have to do some flushing. In some cases, while people are doing construction on whole wings, you have people going in and flushing the water every day just to make sure there's no stagnation. Cross connections, backflow, dead legs, and nutrients. Half of the disease outbreaks related to drinking water have been reported were attributed to Legionella, and all occurred as a result of colonization of plumbing and pipes. Your municipal is sending in water treated with disinfectant, but by the time it reaches your facility and the outlets, the disinfectant residuals have decreased greatly. So in summary, we want to protect your facility from potential pathogen outbreaks. You'll want to be doing this by providing Legionella prevention awareness and creating a water management program. You'll create this in accordance with the CDC toolkit and ASHRAE. And once that's done, you'll present it to your CMS surveyors as they survey your building. So if you get any type of certification from CMS, effective now, you'll want to have a water management program. So that's the Legionella prevention awareness. Then you'll want to prepare your water management program, and finally conduct the implementation. So that's going to be your ongoing updates, verification meetings, and validation, and ongoing measurements. Thank you so much for your attendance today. I do appreciate your time. It was a pleasure, and I will be speaking with everybody shortly.